So really interesting. We'll come to Adrian, then Samira, then Rob. So two parts to this. One is what closing thoughts, what closing bit of advice would you like to leave others with before we close? But second, how hopeful are you feeling? How hopeful are you feeling? We go through loops within the NHS of setting something up and getting very excited and then getting distracted and doing something else. How hopeful are you feeling about how systems develop in health and care over the next few years? So closing reflection and how hopeful are you feeling? Adrian, to kick us off.
Great. So I think my closing reflection would be the really that someone put in the chat trust. Trust at all levels in the system, or between organisations, trust between communities and leaders. That's really important, and taking time to develop that, and relationships don't develop straight away. They need some support in being able to do that. So for me, it's taking the time, build the trust, build the relationships, and then you'll deliver the outcomes. For me, Richard, I'm really optimistic. This is only a year into integrated care systems. A lot of systems have taken the time in the previous 5 years to start to develop those relationships and trust, and you can see the early shoots of that in terms of how outcomes are being delivered in places like Rob's system and several others. And so I'm, as you know, an optimistic person by nature, but also there's some good evidence to say that those green shoots are shooting up.
Adrian, thank you very much indeed. Let's come to Samira. Samira, a closing reflection and where you stand on the hopeometer.
So I'm hopeful. I'm an optimist, and I think, and I've worked in the area of community development for a long time. So I think there is a real more honest conversations about actually the role that communities can play, but also kind of there are conversations happening about handing power over to communities so that they can do what they do really well. So I'm really hopeful about that, and I think ICSs could provide that opportunity to really do that in a way that actually a lot of the previous restructures haven't done it to such an extent. By the way, I've been through every 3-letter acronym restructure in the NHS that you can think of. So I know that's just the nature of organisations. I think just in terms of how some closing reflections, maybe some of the things that I always go back to in terms of what makes a good plan, what makes a good strategy. There's kind of some principles around actually if the starting point, if the ambition and some of the assumptions are actually kind of people always do more when they decide for themselves. So our role is to really create spaces to do that. And that's the only way we can actually kind of deliver the changes. There's something about community and faith spaces, recognizing and investing in community and faith spaces as the lifeblood of local action, because we've seen time and again how they've actually come and mobilized and support that. There's something about recognizing, and I know we don't talk enough about it at the moment, but that race and racism has a negative impact on health, and we really need to recognize it and remember and continue and be persistent in thinking about it as a public health issue. We really need to continue with that. And the final one, just about measuring what people value, and the tools that we use to measure value. So really giving the stories that we hear equal value as opposed to just data. So I'm a real fan of data and looking at evidence, but also stories are a real research and evidence-based tools for really kind of making sense. And also just kind of thinking about some things that may be important to us within a system that we need to measure, but they may actually kind of not be that important for people. So how do we negotiate with them what they value, and how do we actually use those as outcomes in themselves?
Lovely. Samira, thank you very much indeed. The whole webinar we could go into in terms of the value of stories and storytelling within change of any sort, and particularly systems change. Lovely. Rob, closing reflection, optimism level.
Yeah, so thank you for everyone for the conversation. It's always leaves me wanting to have further conversations with a lot of people and pinch their ideas and try and do them as well. I think the first reflection I would have is that, what I always try and build on is the fact that you're not starting from scratch. And just because something becomes a national diktat or fad doesn't mean it suddenly becomes important in a way that it wasn't before. So a really good example would be health and wellbeing boards, health and wellbeing strategies built on joint strategic needs assessments, which have been a statutory requirement since 2012. So you've got a system strategy already in the places within which people live and the big drivers of inequality, the inequity faced by people of colour, the issues that we face in our health and care system about place. So we in West Yorkshire, we use the place strategies from the beginning to say, we've got to start here. What more could we do if we work together at a bigger level to collaborate? And if we were to do that in partnership, true partnership, which valued the contribution of every partner, we maybe get somewhere. So you're never starting from scratch. And if you think you are, you're just going to hack off everybody who's been around this roundabout lots of times before, being asked the same questions if they're in the community or a GP or a counsellor and all that sort of stuff. So use the assets that are there because they're brilliant. I think how hopeful am I? Well, I am concerned that there are some substantial risks ahead of us. And we are entering a difficult period. I think we're already in a difficult period, but we're entering a difficult period for integrated care systems and integrated care. I think there are a lot of people who comment that, you know, what are they for? They're really difficult, complicated things. And they see them through an organisational lens. Integrated care systems a system. You need system thinking. It's a novel approach to delivering change. Integrated care boards are organisations in that system. So people need to clock that and stick with it because the solutions to the problems we face are in systems and good organisations. So that and the political turmoil we're in means that I'm a bit worried. I am hopeful though, because I don't think, even if you change the structures and the organisations, you still need a system approach to tackling the issues. And I think we've developed enough of a movement of people and leaders whose minds are being changed for this to persist. So I'm concerned and hopeful.